I'm so excited about this nation building camp. Imagine, we get to create our entire country from scratch. We get to create our own society, our own governments, everything.
What's our first team assignment?
Remember, we're a team of healthcare systems experts, and we're going to propose a healthcare system to a team of judges.
But there will be another team of healthcare systems experts who are also going to go before the judges with their proposal. We have to get the judges to agree to our system. It's sort of like a debate. We just have to win. We can't lose.
Well, then let's propose single-payer national health insurance then.
No way. Did you hear me? I want to win. The judges aren't going to consider any system if it's not exactly what we have right now here in the good old USA.
Have you even been reading the news? The U.S. is in a healthcare crisis.
Don't be silly. We just have a couple of problems that we can fix with a tweak here or there.
Okay. Calm down. Let's just practice some arguments from both types of systems.
I'll go first. The United States has the best healthcare system in the world because we have the best medical treatments, the best doctors, the best hospitals, and the best technology in the world.
Well, I wouldn't use that as an argument when we're actually rated 37th in the world by the World Health Organization, just below Costa Rica and just above Slovenia.
Yes, that's where we're ranked, but that's because they take everything into account. The number of people who get healthcare, how healthy the overall population is, how happy people are with their healthcare, how much it costs.
You can't win with an argument about cost. The U.S. spends twice as much per person as any other country with national health insurance, and we don't even cover 46 million of our citizens. And their healthcare is universal. Everyone gets it.
Yeah, and even though we spend twice as much, our medical outcomes are no better than theirs. They have lower infant and maternal mortality rates. Other countries do more bone marrow and kidney transplants than we do, even more hip replacements.
Yeah, we smoke and drink less. We have the youngest population, yet they live 2 years longer? Go figure.
Well, people in other countries have to wait forever to get important diagnostic tests. Like Canada. People with cancer there, they have to wait months to get their medical procedures and diagnostic tests. That's why so many Canadians come here for medical treatment and why so many Canadian doctors want to practice here in the United States.
Don't you remember that's a myth? Look, it says right here that since 2003, more physicians return to Canada than come here. And here are the actual wait times. Radiotherapy, 6 days, chemotherapy, 2 weeks, knee replacement, 5 weeks. And a survey of 18,000 Canadians showed that only 20 came to the U.S. for healthcare.
You think of something.
It's un-American to have government-run healthcare, because if we have single-payer, then the government would be telling us what kind of medical treatments we can have and we can't have, and when we can go to the doctor and when we can't go to the doctor.
Well, that's what private plans do now. They tell you who you can see and what kind of treatments you can have. Private health insurance has to cut back on medical care in order to make a profit. And anyway, single-payer is not government-run. It's just paid for by the government. We still use private doctors and private hospitals in a single-payer system.
Taxes! Why, we'd end up paying more and more and more taxes. We'd be taxed to death. You just can't trust the government with money.
Actually, we'd end up paying less for healthcare if we had single-payer health insurance. We'd save $350 billion alone just by eliminating private plans. Remember, we spend over 30% of our premium dollars just to administrative costs that have nothing to do with healthcare, like executive salaries, payments to stockholders, marketing costs, lobbying. And don't forget that all that money just goes to insurance bureaucrats who deny your treatment. I mean, Medicare only pays about 4% in administrative costs.
And 60% of healthcare in America is already paid for through taxes anyway. Medicare, Medicaid, the VA, the military, the Indian Health Service. Oh, and the government employees' health insurance. Local, state, and federal, our tax dollars pay for them.
I guess that's why 66% of Americans and 59% of doctors want a single-payer universal health insurance.
This is insane. Look, when you read up on all the facts, single-payer national health insurance is just better. It costs less and everyone gets health care, and they get as good or better treatment.
Yeah, how can we compete with that? I don't know why we would want to argue for what the United States has now.
Because the United States is the best country on earth. We're the leaders. We don't follow the pack. We don't want to do what other countries do.
I don't see how we can win either if we don't have any facts that support a US-style system. The facts support single payer.
Look, guys, facts don't really matter.
The facts don't matter?
No, they don't matter. The facts aren't going to sway the judges. We just have to make it seem like it's bad for everybody to get healthcare. Use scare tactics. Like, if everybody had healthcare, then there wouldn't be enough to go around.
But why would they believe that? When all those other countries cover everyone and only pay half as much per person in healthcare costs as the US does, plus their medical outcomes are as good or better.
We have to distract them with little code words that Americans associate with bad things like socialized and government run and rationing. When you use those words, people stop listening to the other side.
But our fire departments, our police, our military are socialized because everyone contributes to the cost through taxes and everyone gets to use their services. And single payer isn't even run by the government. It's just paid for by the government.
Yeah, and the US rations healthcare because if you don't have health insurance or you're underinsured, you don't get the healthcare you need.
That's right. I mean, other countries don't really ration because everyone gets healthcare. And no one is left out. It's some rationing.
Well, then we'll talk about capitalism. Americans have been told over and over again that markets, free markets, and competition keep costs down. Just compare health insurance to car insurance. People just need to shop around and find the best health plan for the best price.
But competition isn't keeping costs down. If that was true, then we wouldn't have such huge increases in healthcare premiums and copays and deductibles every year. Don't you remember that since 2000, health premiums have gone up by 87% and wages have only gone up by 20%? In fact, the only way to get true competition is with a single-payer healthcare system where people can choose any doctor and any hospital that they want.
And you can't really compare a car to your health. You don't need a car to live, but you do need your health. Health is not a commodity.
And you can't choose if you're going to get sick or not, or what disease you're going to get if you do get sick, the way you can choose a car.
I'm telling you, we can win if we propose a system like we have right here, right now in the good old USA.
Okay, I know we're talking about a fake country here, but to win, we still need to propose the best system, and we can't win if we propose a system like we have now in the United States. It just doesn't make sense.
I told you. We can only win if we present them with a system that they're already familiar with. Even if it's a bad system, the unknown is just too scary. They won't accept it. They will only accept what they're already familiar with. And we have to win at all costs.
But wait, the American healthcare system, it costs twice as much, doesn't cover a big chunk of the population, and still doesn't have better health outcomes. How can we win with a system like that?
Yeah, we can't win.
Oh, you're not even listening to me!
Look, I really want to have the winning proposal, and that's a single-payer system. When a citizen gets sick, they get health care, no matter what. I'm gonna go work on the winning proposal. Anyone who wants to join me is welcome.
Hey, wait for me, and let's just copy H.R. 676, the Medicare for All bill in Congress. It'll take less time than writing one from scratch. I mean, look, we're at camp, I want to have fun.
We just look stupid trying to defend our system. I'm leaving.
Hold on, wait, come back! This is a group project anyway! Ugh! You guys, I don't care if we have to use irrational arguments. You're messing this up! Americans should expect the best healthcare in the world.
You be the judge. Get the facts on single-payer national health insurance.
Support H.R. 676, the Medicare for All bill in Congress.
Find out more at Physicians for a National Health Program at www.pnhp.org or Healthcare Now at www.healthcare-now.org.